Hello everyone. Today we will learn about the diagnosis and treatment of benign prostatic hyperplasia. First, we need to learn about the prostate. What is the prostate? The position of the prostate in the body is shown in the yellow circle on the left picture. The prostate is part of the lower urinary tract of the male, surrounding the urethra and adjacent to the bladder. The prostatic fluid it secretes is an important part of semen. Benign prostatic hyperplasia for short, is also known as benign hypertrophy of prostate. Pathologically, it is manifested as cell proliferation instead of cell hypertrophy, hence the name prostatic hyperplasia. It is the most common benign disease that cause dysuria in elderly men. The major symptoms include the symptoms in the urine storage period, the symptoms in the urination period, and the symptoms after urination. The symptoms in the urine storage period are frequent urination, increased urination at night, urgency, and urinary incontinence. Frequent urination is the most common early symptoms in patients with prostatic hyperplasia, especially at night. The symptoms in urination period are urinary hesitancy, dysuria, and intermittent urination. Dysuria is the most important symptom for prostatic hyperplasia, which develops slowly. It is typically manifested by slow intermittent urination, weak urinary stream, shortened range, dribbling after urination, and extended time. The symptoms after urination mainly include incomplete voiding and dribbling after urination. In case of severe obstruction with more residual urine volume, the patient's abdomen shall be often pressed hard to help urinate, and the patient often develops a sense of incomplete voiding after urination. The rupture of large blood vessels on the surface of mucosa of a large gland may also cause painless gross hematuria in varying degrees, which should be distinguished from hematuria caused by urologic tumors. Prostate hyperplasia leads to dysuria and increased residual urine, which may result in repeated urinary tract infection and bladder calculi. The serious hydronephrosis and renal function damage may be developed into chronic renal dysfunction, manifested by loss of appetite, nausea, vomit, anemia, fatigue, and other symptoms. A mass may be felt in the lower abdomen in case of urine retention. A mass may be felt in the upper abdomen in case of severe hydronephrosis. The symptoms of lower urinary tract may also be caused by other diseases such as bladder or urethral disease and prostatic tumor, so differential diagnosis is needed. How is benign prostatic hyperplasia diagnosed? The possibility of prostatic hyperplasia should be considered when a man over 50 years old presents with typical clinical manifestation of dysuria. The first step of diagnosis is to ask the medical history, do an international prostate symptom score, and get to know the severity of symptoms of lower urinary tract. After that, digital rectal examination is performed. Digital rectal examination is an important method of examination which is required for every case of prostatic hyperplasia. For most cases, during the digital rectal examination, the enlarged prostate can be felt to be smooth and resilient with clear edge and middle ditch becoming shallow or disappearing, and then a preliminary diagnosis can be made. Attention should be paid to whether the anal sphincter tension is normal or not at the end of the finger examination. Moreover, Following examinations are also needed. Routine urine analysis shall be conducted to determine whether there are pyuria, hematuria, proteinuria, and increase of urine glucose. The test on urine flow rate helps determine the severity of urination obstruction in patients with prostatic hyperplasia. The urination volume is required to be 150 to 200 ml during the test, and if maximum urine flow rate is less than 15 ml per second, the urination difficulty is suggested, and if it is less than 10 ml per second, the obstruction is serious, which is one of the common surgical indications. How to use the IPSS. Fill in the IPSS once a month. Score various lower urinary tract symptoms commonly seen in benign prostatic hyperplasia, and the severity of the symptoms can be determined according to the total symptom score. In terms of scale of marks of IPSS, 0 to 7 points means mild hyperplasia, 8 to 19 points means moderate hyperplasia, and 30 to 35 means severe hyperplasia. The quality of life score, 0 to 6, is an understanding of the patient's subjective perception of their current level of lower urinary tract symptoms over their lifetime. And this main concern is the degree to which the patient is afflicted with lower urinary tract symptoms and whether the patient can tolerate. Therefore, it is also called the border for score. The differential diagnosis of benign prostatic hyperplasia mainly includes the following: bladder neck contracture, also known as bladder neck fibrosis. It is mainly caused by chronic inflammation of the bladder neck contracture with a younger age of onset, mostly in the age of 40 to 50 years, with the symptoms of dysuria. However, the prostate does not increase in size, and the diagnosis can be confirmed by cystoscopy. The neurogenic urinary bladder dysfunction and prostatic hyperplasia are both dynamic obstructions with similar clinical manifestations, characterized by dysuria, a large amount of residual urine, hydronephrosis, and renal dysfunction. Patients often have a medical history and present with manifestation of central or peripheral nervous system damages such as lower extremity sensation and movement disorders, decreased cutaneous sensation at perineum, relaxation of anal sphincter, or disappearance of reflex. The intravenous urography often shows dilation of hydrops of upper urinary tract and bladder in the shape of Christmas tree. A definitive diagnosis can be made by urodynamic study. For prostate cancer, there are nodules in the prostate, hard consistency, or elevated serum PSA. MRI and systematic prostate biopsy are required for differentiation. It is not difficult to diagnose the case of urethral stricture with urethral injuries and the medical history of infection by performing cystography and ureteroscopy. The treatment of prostatic hyperplasia is mainly determined by IPSS score and quality of life. Patients with mild clinical symptoms and QOL not significantly affected can be kept under medical observation. Patients with severe clinical symptoms and QOL significantly reduced can be treated with drugs. Surgical treatments can be considered for patients with very severe clinical symptoms and poor response to drug treatment. For the patients under medical observation, it is required to fully learn about the disease, gout diet and life care, monitor changes in condition, and change treatment strategies in timely manner. What situation may suggest an aggravation of BPH? The major situations are aggravation of lower urinary tract symptoms, continuous decrease of maximum urinary flow rate, occurrence or increase of residual urine volume, occurrence of related complications, and surgical treatment. When the condition aggravates and QOL is affected, the drug treatment is needed as the most commonly used in clinical at present. The short-term goal of drug treatment is to alleviate symptoms of the lower urinary tract, and the long-term goal is to delay the disease progression and prevent complications. There are many drugs for treatment of prostatic hyperplasia, and commonly used are alpha adrenergic receptor blocker, 5A reductase inhibitor, M receptor blocker, traditional Chinese medicine, and botanical drugs. As the alpha-1 receptor distributed in smooth muscles of prostate matrix has a large impact on urination, are delivering a good therapeutic effect on patients with mild symptoms and smaller prostatic hyperplasia. The drugs have slight side effects such as dizziness, nasal congestion, and orthostatic hypotension. The 5A reductase inhibitor is a hormone drug that prevents testosterone from turning into dihydrotestosterone in the prostate, thereby partially downsizing the prostate and improving urination symptoms. It usually works after 3 months of medication, and long-term medication is required as the symptoms may reoccur after discontinuation. The patients with larger prostate is recommended to take together with alpha receptor blocker. M receptor antagonists relieve excessive contraction of the Foxen muscle and reduce bladder sensitivity by blocking bladder M receptors to improve the storage symptoms of BPH patients. Plant preparations such as prostate are indicated for the treatment of BPH and related lower urinary tract symptoms. Surgical treatment. Surgical treatment should be considered for patients with severe obstruction of prostatic hyperplasia, large amounts of residual urine, apparent symptoms, poor response to drug treatment, and physical conditions able to withstand surgery. Suprapubic transvesical prostatectomy or retropubic prostatectomy are usually performed. The transurethral prostatectomy suitable for most patients with benign prostatic hyperplasia and can be performed by surgeons with experience in reductomy. Laser treatment. The NDYAG laser has modes of contact, non-contact, and tissue insertion, and its corrective effect is not very ideal. At present, hormone laxer and green laxer are used in the treatment of prostatic hyperplasia with affirmative corrective effects. The past surgical indications are severe symptoms of urination obstruction, more than 50 ml of residual urine in the bladder, or a history of acute urine retention, poor response to drug treatment, and physical conditions able to withstand a surgery. The conditions where surgery is recommended are repeated urine retention, hematuria with no response to 5-alpha receptor blocker treatment, complicated by bladder calculi, recurrent urinary tract infection, and occurrence of complications such as hydronephrosis and inguinal hernia. Other therapies: transurethral high pressure balloon catheter dilation, wall stent in prostatic urethra, and transurethral microwave thermotherapy. The extracorporeal high-intensity focused ultrasound is associated with relieving obstructive symptoms caused by benign prostatic hyperplasia and is suitable for patients who cannot tolerate surgery.